This is a great question. Why is it that sometimes we are on diuretics like Lasix, whereas other times we're on diuretics that are thiazide diuretics? Let's talk about it. It has something to do with each baby and their clinical status and what our providers choose for the type of diuretic. So, loop diuretics like Lasix or furosemide, we know that they work on the loop of Henle to block sodium, potassium, and chloride reabsorption. These are very powerful diuretics. They're strong, they're rapid acting, and they're typically used when there's acute pulmonary edema or acute need to diurese. When the baby is having struggles with ventilation and oxygenation, and you see on that chest x-ray that it's really hazy, Lasix might be given to kind of help provide this rescue offloading of fluid, help them diurese, get rid of that fluid. What are the concerns about Lasix? Why don't we just use it all the time? Well, Lasix causes a lot of electrolyte wasting. We lose potassium, chloride, calcium, magnesium. That contributes to metabolic alkalosis and also increases the risk of nephrocalcinosis or renal stones with long-term use, as well as osteopenia prematurity. As we lose all that calcium, I think about their poor little bones. The other things, remember, Lasix has the risk of ototoxicity when we're giving higher doses. So typically, our providers don't usually want to use Lasix long term in chronic kiddos with BPD unless they absolutely have to. And then we have our thiazide diuretics, hydrochlorothiazide or chlorothiazide. They work on the distal convoluted tubule, which inhibits sodium and chloride reabsorption. It's weaker than loop diuretics and has a slower onset. So its indications are for the chronic fluid management of babies with bronchopulmonary dysplasia who need long-term diuretic therapy. You often see it combined with a potassium-sparing diuretic like spironolactone or aldactone to reduce potassium and chloride loss. And they're chosen because they're considered to be like gentler on the electrolyte and calcium balance compared to loop diuretics. But they're still diuretics, so there's still concerns that we lose sodium, potassium, and chloride, but less severely compared to Lasix. So you might see these babies on electrolyte supplements. And similarly, it can contribute to metabolic alkalosis, but generally to a lesser degree compared to Lasix. And it's less effective for acute pulmonary edema. So it's not used in an urgent situation. So we can kind of think about it as your thiazide diuretics more for chronic management of BPD and fluid status, whereas Lasix is more for acute needs to diurese. Hope that was helpful.